us, you've only been at it for 4 months, at least, since you've been out of school, but tell us a story. Janet just shared a story. Tell us a story how you have changed somebody's world, like you talked about, over the last 4 months.
Sure. Let's see. So one family comes to mind. They have a few kids. I think there's 5 or 6 or 7 of them under the age of 10 or 11. It's a big family. I grew up in a similar family, so they have a special spot in my heart. They were headed downtown for a Disney on Ice type thing. The kids were pumped. They've been waiting for months to this. And I think it was a Friday afternoon. And I get a text from the mom saying, "Hey, our youngest there's a Lego stuck up their nose."
Oh my gosh.
Great.
Yeah.
Meet me at the clinic, because I was already home. I said, "Meet me at the clinic. We'll get rid of it. No problem." So on their way to the Disney on Ice, they swing by the clinic. We pop it out real quick, and all the kids stayed in the car. Just the mom came in with the youngest. And then they went on their way. And in my mind, I'm like, usually they'd get turfed to urgent care. It'd be a couple hours waiting. That's a small thing. Sure, they didn't lose a ton of weight. Sure, they didn't get off all their meds. But it's like that type of thing is why I love this, is because it's medicine and primary care for our life today. I just need a quick Lego out of my nose, for crying out loud. I don't want to go sit at the children's hospital for 6 hours.
Yeah.
And so I loved that, and obviously they loved it too. They're very, very grateful. But
they would have missed Disney on Ice for sure.
They would have, no doubt.
And let's just be really honest, Dr. Brown. It would have been an 8 to 12 hour adventure. I mean, seriously, it probably would have. Maybe an urgent care, no, but if it was later at night, ER for sure.
Definitely.
And let's talk about price. At least $1,000 in the urgent care. And we have no idea because there's no transparency and there's all these surprises. Yeah. But tell us what your fees are for direct primary care and how that was covered under that.
Sure. So we have it age-based tiers. 45 and above is $105 a month. 18 to 44 is $85 a month. And then younger than 18 is only $40 a month. And so that was all covered. We have unrestricted access. It was whatever you need. You just swing by. They came by. It was a free Lego removal, all included. I should put that on my website, actually.
Right.
No, so it was, it's all, texts, calls, emails, FaceTime, whatever they need. And I actually did have a mom the other day email me a picture of her son's, a 7-year-old's arm that was kind of like shaped like it was crooked. I was like, hey, that's a little more urgent. You should probably call for that one. But she's like, well, I didn't want to disturb. Patients are extremely respectful of our time, and it almost to a fault. I said, hey, that's one of the times you should probably just call me.
You know why that is? So we feel that way about our patients too. And when we have team members come from, another XYZ pharmacy, they'll say about how nice our patients are and how our patients are different. Well, we come from the same area, right?
Yeah.
So, but you know what's different? It's how we treat them. We respect their time, and they respect our time. And honestly, if the doctor's only going to give you 3 minutes of time, do you expect them to respect you? I mean, seriously. I mean, you have a comment on that?
That's a great point. I mean, it's you give a mouse a cookie, you give someone just a little bit, and if they know that's all they're going to get, they're going to take as much as possible.
Right.
But if they know they have unrestricted access, they're like, hey, I'll just text you when I need you. I love that. And that's the first question. I'm sure you've heard it too, is from other healthcare professionals wanting to do a direct care type of model. What about being on call 24/7? It's like, well, yeah, technically, but in the 18 months that I've technically been open, I've had maybe one call between the hours of 8 p.m. and 8 a.m., and it's like, it was at 7:30 in the morning, for goodness sakes. And so,
and you're right. And your colleagues that work at big corporate clinics, I know that things are a lot different with hospitalists and stuff now, but how often do those family practice doctors get call when they're on call at those big corporate clinics?
All the time, all night,
every night, all night long. They just don't get sleep.
They don't stop ringing. Yeah. Metformin refills at 3 a.m. just kill me. I don't understand.
Right.
but people know they can get directly to a doctor when they call after hours. So in my mind, it's like, why not do it during hours, for crying out loud?
Yeah, exactly.